All right, we've got a full house today. I'm so glad to see everybody. My name is David Baker. I'm president for this Rotary here. And let's kick off this week by saying the four-way test of what we think, say, or do. Is it the truth? Is it there? Please stay standing for patriotic song and the pledge.
Yeah. Let's sing America. That's my country too. My country is the sweet land of liberty of the unseen. Dream inside and free. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Please be seated. Okay. Well, Fayetteville, and then you have Mayflower. Mayflower. But you know what? It's almost 60 degrees outside. I don't quite figure that out. But anyway, we're gonna sing about my Tootsie Wootsie. You know, it's my favorite song. So how about the little summertime? In the good old fun. That's very good, Rotary. Let's see what.
You get down to Tootsie Wootsie, whatever they say. I don't know what that is. There's a different. All right. Visiting Rotarians from the north side of Fayetteville. He just slipped in during the pledge. Oh, let me go ahead. You got a guess.
Mr.
Yeah, and a bike man.
They was supposed to go on this forum.
He was, he told him how the lightly fun will have to do this.
With your favorite Tootsie Wootsie. Yes.
Fellow Rotary, please help me welcome my good friend, Craig. He is a commercial lady, and I gotta get first star. Which is here, the other law firm out there by. Craig is a scout from his home state of Louisiana, and we work together on some legal work. He works Craig up.
What did you say you had a guess?
Oh, I do. All right, I'm pleased to introduce you to Elise Fletcher. She is a sophomore finance major at the University of Arkansas from Austin, Texas. And if her twin sister marries my cousin's son, we'll be with 10. He's not telling you.
Has a guess. There we go. We don't have any lawyers here, you know. I'm gonna that you guys, you might have missed me, but I know you missed these jokes. In
Oh, iron. That's East nice first.
Yeah, would be. You have that today.
It's in here somewhere. They're all kind of the same. Like. So this is courtesy of Fayetteville County Bureau, we live there, and these are here. Also, the pickleball jokes, and I'm going to return the company this weekend, and they were actually objectively and significantly. I picked two that weren't as bad as all the others, but, what did the farmer say when he lost his cow? It was a mistake. Very bad. What is a horse's favorite game to play?
In the tail on the dog.
That's pretty good. Stable tennis. Is it terrible? Why do the farmers go to the movies? I hate it. Watch the trailer. Okay, and then, Ken and Dr. Ross here today, I found with the combo of pickleball and dentistry. Yeah. Yeah, I had to rate like 50 after this one. What do a dentist and a pickleball instructor have in common? They have a few drills. Yeah. And then finally, one fish, no good. They don't like being anywhere near that. I'm going to the bed. We'll been indicating here in a moment before I do so. I want to recognize Chuck Ford. That passed, and I want to play this a moment of silence. And of course, we have other Rotarians in the room with the family connection. Tim, Chaddy Facility, Ray Culver Jr., Ray Charles Culver Jr. And it was a terrific service. I told Chuck that his remarks were meaningful enough when I actually went home was night early yesterday. So had a really back. Just a moment of time to not be the indication. Please join me in good tradition as I pray. As we gather here today, as members of Rotary, we pray that we are ever mindful of our opportunities to render our service to fellow citizens and to our community, keeping in mind always the enduring values of life, exerting our efforts in those areas and those things upon which future generations can build confidence. Let us continue to strive to make a better world. Amen.
Hey, why don't you talk about this and then I'll do the. What do we have?
Well, you think about, we still need a few volunteers. Sunday morning, 8:30 to noon, 2 people to be at the metal presentation table. And then also on Sunday afternoon, is the 3, we need 2 more people. Saturday from noon to 3, we need 1 metal presentation. And then we're still need 3 or 4 more people for taking the course tomorrow at 5.
Friday tomorrow is the biggest of all, okay, and 2 or 3 more people just to help take.
If you come to watch, and we'd love for you to do that, bring a folding chair, there's really nowhere to sit, but there's a space for the chair. Thank you.
Dad, you were about to say something. Oh. Make sure Christine knows. Christine or Jimmy, because Harrison. Oh, good. All right, so, okay, I know what we're doing. So, this is, about, the monthly recurring initiative that we have. It needs a better name that way. So open to, suggestions on that. Basically, what this is, for any Rotarian that knows we have ability to do online recurring auto pay, $10 a minimum to the foundation. And once you do that, it's voluntary, of course, it's not a requirement or anything, don't do it if you don't want. But it just helps build up our club foundation. And every quarter, this was to begin back in beginning of the Rotary year. At the end of that quarter, we would draw out of the name that it contributed. And whoever's name is drawn, the foundation would donate $1,000 to a local nonprofit in that person's name. And so we're actually behind schedule and doing the drawing. So this is the first one. This should be the third one actually. But we were gonna do one today and make sure we started talking about it. And then over the next 2 weeks and at the end of this Rotary year, we'll do the full year. So it's.
You never did.
What do you need to do?
You just need to tell me some more what you want. Working. I'm gonna go to the Washington County Historical Society. We'll make it happen.
Sure.
Hey. What about bucket?
No, as a neighbor.
Hey. I like that. You gotta. I'm not that guy. I think it's better.
Thank you, Harrison. Congratulations again. Yeah, that's a great. So, welcome, Jennifer. What are you with us today? He stepped up and avoided having to talk and introduce himself. We'll get it next time. Right. Okay, for Avery, welcome him. And we'll take a few minutes here and give Ron the microphone. History.
You know, one of the great things about Rotary Club then and now is that you get to sit and visit with folks and friends and have lunch with them. I sat with President Day and you learn something all the time. We're kind of kindred. We were talking, I'm not going to tell you how we got there, but he told me he played the alto sax, and I said, "Ha, me too." But you know what? I played the tenor also. You know what that makes me? Bisexual. He told me I had to tell it.
Bisexual.
Don't look at me like that. Back in the old days, we had something called 3H. That was called hunger, health, hunger, and humanity. And Polio Plus grew out of that. One of the great things we've done. We're working on malaria now. But when I was thinking about 3H, I thought about one of the programs that we had and one of the things we did in this Rotary Club that I think is one of the greatest events we ever did. Dr. J. McDonald joined our club in 1977. By 1981, he was chairman of the three-way committee in the local club. He had a friend who was a doctor from India. And somehow he brought him and we had a program or two. But what we found out was that blindness in Chatty, we were talking about blindness today. So I've got a double here today. But blindness in India is a serious, serious problem. We're talking about 1981. That's over 45 years ago. People were blind because they couldn't afford the surgery. They had cataracts and they couldn't even get it done. So Jay introduced through the three-way test committee an idea that we would see what we could do. He got a grant from Rotary International in the district, $220,000. He put a team together with doctors. They went to India, I think more than once. The idea was they trained doctors on a little procedure that he was aware of, where they removed the cataract, and then they did something about interocular lens placement. And there are lots, and they trained at least 200 doctors or more. And today a lot of people in India are not blind. They've avoided it, and a lot of people were given sight again. That started this Rotary Club from a Rotarian. Howard, that's your club. CJ, by the way, and I know a lot of you probably know him, tell him we still appreciate him, would you?
Okay. This is this weekend. We've already had an announcement, but do we have anything more to say or announce about the battle this weekend? Anyone? All right. Okay, so we have a new nightclub coming, this coming Tuesday. The service project is at the Children's Safety Center of Washington County. Do we have anybody who wants to comment about that before I move on? Anyone? Yes, Chad. Its location is right next to the Arvest Ballpark. On Gene George Boulevard.
Yeah.
Don Tyson exit toward Arvest Ballpark. Turn right on Gene George and it's on the left. Okay. It'll be in next week's newsletter. And see, so the if I remember reading this right in the newsletter, and I apologize for not knowing better, but I think is it the tour of the facility and gaining a knowledge of it? So this is more of a field trip. So this is a nightclub field trip, what is it? Okay. All right. So at this time, I'll hand the mic over to Dr. Kenton Ramos.
I was over at Harrison's the other night for pizza. And you always have your guards up a little bit, but it tasted pretty good. I said, Harrison, what kind of pizza is this? He said, well, it's a Himalayan pizza. I said, I think I've ever had Himalayan pizza. And I said, what's in it? And he said, I don't know. I found Himalayan on the road and I made it a pizza. So, anyway, it's my pleasure this is our third and final installment of what you didn't know you needed to know about sleep and breathing and airway and how dentistry is involved in all that. I brought with me today Dr. James Robley, and James grew up here in Fayetteville. He's a University of Arkansas graduate of Texas A&M, formerly known as Baylor College of Dentistry. And as if that wasn't enough, he went to UCLA, did a 2-year oral-facial pain residency, and then followed that at the University of Pacific with his orthodontics residency. So he's a rare dual specialty orthodontist, oral-facial pain specialist. And so we're so fortunate to have him in Arkansas. Is there another oral-facial pain specialist in Arkansas? Maybe in Little Rock? Yeah. But we're so fortunate to have him. So when we get things that we can't figure out, that's not run of the mill, James knows how to run through all the bases and figure out what's going on with oral facial pain. But first of all, we would like to try to not be in oral facial pain. He's going to take you through some of the things that we do to set things up for success for our patients. So he's married to Holly. They have 3 lovely children. And without further ado, please welcome James Robley.
Thank you, Dr. Ross. First of all, I just want to mention that it's an honor to be here. This group is very prestigious, long history. I think I heard 105 years. Is that right? Okay. That's impressive. So thank you for having me. It's an honor. Like Dr. Ross was saying, this is my family. It's consuming most of my time right now. Wife Holly, 3 boys, got a 6-year-old, 4-year-old, and we just celebrated the youngest first year about 2 weeks ago. So never a dull moment at our house. Like Dr. Ross was saying, the orthodontics and oral facial pain, orthodontics is kind of what you'd expect an orthodontist to be, right? Braces, expander, Invisalign, that kind of stuff. With oral facial pain, it's more about the jaw pain, headaches, pain in the actual joint, neck pain. And it also kind of incorporates some airway too. When I was doing my training in orofacial pain, there's a big leg of that went to airway. And the reason for that was because about 10 to 15% of the population of people who have chronic pain, whether that's lower back, upper back, neck, TMJ, those are the most common areas. 10 to 15% don't typically respond to normal treatments. And sure enough, if you go send those people to get a sleep study, a lot of times they do have some sort of sleep disorder breathing. Okay, so then you start to treat that, you start to get the inflammation down, and you start to get their pain pain under control. So I've been out in the real world for about 7 years, but I started my own practice about a year ago. So that's been fun and time consuming. We're excited with me and my little team. This is the space that we're moving into, so that hopefully will be done in about a year, by the end of this year, but we'll see. I heard usually that takes longer than they say. But new frontiers in orthodontics, nasal breathing, sleep, facial development, and marquee expansion. And yes, I would like to take on the torch from the two other lectures that were done this month in dentistry and also cognitive behavioral therapy. I know I think everyone, not just insomniac patients, but everyone needs cognitive behavioral therapy these days. It's really important. I'm a big believer in mindfulness and that sort of thing. But anyway, back to new frontiers in orthodontics. We've got all this technology now. It's wonderful. We've got 3D imaging. We've got treatment planning with AI. That's the big buzzword right now is AI. But what I'd like to do before we kind of jump into what I am most passionate about is go back in time to the early 1800s. And let's talk about this guy for a second. His name was George Catlin, and he was a painter, explorer, and accidental breathing specialist. Okay, he was actually a lawyer who decided he didn't like being a lawyer and quit, taught himself how to paint, actually became really good at it, and then was inspired by the Lewis and Clark travels. And he kind of he traveled his own way and got into these indigenous tribes throughout the country. And when he would go, what he would do, he would take painting, he would make paintings and portraits of these indigenous populations. And what was fascinating for him was that he was looking at their teeth, their jaw structures, their overall health, and he was floored by how perfect their teeth were, how perfect in alignment things were, how they breathed through their nose with ease, and they weren't breathing through their mouth. He noticed that when infants at a young age, if they had a little bit of a cold or a sickness, the mother would put them on a little concave pillow that would promote them to want to keep their lips together. And if they still were breathing through their mouth, they would close the lips of the infant. And what's fascinating is that these are practices across all 48 tribes. And you got to remember that most of these tribes weren't connected. Okay, so it's passed down through generations that these people knew the importance of nasal breathing. And not just nasal breathing sometimes, but nasal breathing 100% of the time. And so he grew passionate about this subject. And he wrote a book. It's called Shut Your Mouth and Save Your Life. And you can imagine that the medical and physicians at the time didn't take too kindly to this paper and this book. But anyway, he talked about the facial cascade where teeth of a mouth breather are really protruded, which means they're kind of just flared outwards. Talks about the natural expression is flat or lost, meaning that people who mouth breathe kind of have that flat affect, if you will. A lot of that's related to lack of sleep or at least quality of sleep. Voice is affected because when we're breathing through our mouth, our mid-facial structures, cheekbones, sinuses, nasal passages don't grow as robustly as they should. Therefore, voice can be affected along with other things. The paradox here is that when he was going to these tribes, there was no dentists, there were no toothbrushes, there were no medical facilities, no doctors, but they all were 100% healthy, all were breathing through their nose. None of them had cavities. We'd go back to where the English settlers were staying, and everybody was sick. Everyone was mouth breathing. They had all the doctors in the world, but it didn't matter. Everyone was perpetually sick. So he concluded that shutting your mouth was a really important thing. It turns out he was right. This is an actual quote from him. He said, "There is not in the whole catalog of human diseases one which is so destructive, so easily prevented, and so entirely unrecognized as mouth breathing." He would go on to say that "Shut your mouth and save your life" should be etched on every crib in the world. But here, let's move on to some just visible signs of mouth breathing, kind of what it looks like. And you can see here, this is kind of what we'd call an adenoid facies, where we have the long face, very constricted arches, tired. Also the dark circles under the eyes, those are called allergic shiners. Those really only appear if you're mouth breathing. Okay. You could, not sleep at all. You could have horrible sleep, but if you're breathing through your nose, you really would not have those. So it's insight into what's really going on. Of course, things like bad breath, crowded teeth, and also our sleep is very fragmented when we use our mouth to breathe. So what does our nose do? Well, it's actually does a lot more than just smell things. One is it's going to warm the air for us. When we breathe through our nose, that's going to heat up the air to our internal temperature, which is important for the lungs to accept that oxygen coming in. It's going to humidify the air so that when the humidified air comes in, we have these mucosal layers throughout our airway tract, the membranes, if you will, that need to stay more or less wet. They don't need to be dry. So by humidifying the air, they stay wet, they stay functioning, and they stay filtering out particles. When we breathe through our mouth, we draw out those tissues. It has a 3-stage filtration system. Front of the nose, those coarse hairs, that's one of them. Another one is just the mucous membrane I just talked about. And then also there's these little hairs under the nose that are called ciliae. And then lastly, nitric oxide. This is a big one. It's cool to think that when you breathe through your nose, it actually stimulates the release of a gas called nitric oxide. And that helps to open up the little sacs in your lungs so you can breathe deeper and easier. Real quickly, I'm going to start going through this a little bit faster. The body keeps the score. So when we're nasal breathing, our blood pressure literally goes down. Mechanisms for that will be the vasodilation from that nitric oxide that I was talking about. Brain activity. There was a research paper, I think 2023 from Northwestern showing that individuals who are nasal breathing perform 70% better at memory and coding than versus the mouth breathing counterparts. And they said that there's a synchronization of the brain's electrical activity, both during the day, but what's more important is at nighttime, that electrical activity is not gone awry because we have to really heal the inflammation that's gone on in not just in our body, but also our brain. And if we're not sleeping deeply, we can't do that. Okay, we already talked about the immune system, more or less, the 3-stage filtration system. And then the big one for dentists, teeth. Mouth breathing is going to create a breeding ground for an acidic environment. So a breeding ground for bacteria that love to cause cavities. In fact, there was a recent survey that was done on what was the number one most preventable cause of cavities. And sure enough, that's mouth breathing. And pulp culture knows, I don't know if we have sound here.
Sorry,
That's okay.
I don't have it plugged into.
That's okay. You get the point. So this is Stranger Things and then also Hocus Pocus. But when I typed this in, I actually found like 15 different TV and movie clips that actually talk about making fun of mouth breathers, more or less. And they all have the very stereotypical facial features of a mouth breather. And so Hollywood gets it. And then, kids get it. And you don't know why they have those facial features, but they do. And they tend to be a little bit, either ADHD or a little bit slower sometimes. They may not seem fully awake because they're not getting good rest. So if pulp culture gets it, then I think we need to do a better job of understanding where, especially the kids are in this whole situation. Domino effect with kids who are mouth breathing, they're 73% likely to have trouble paying attention at school. In addition, those who are mouth breathing have a 66% chance of showing some signs of hyperactivity. So that would be like an ADHD diagnosis. And a lot of countries in Europe actually see ADHD as a breathing and sleep problem and not actually a brain problem. And when we find that when we get these kids and adults too to sleep better and have higher quality sleep, that allows for that prefrontal cortex, the part of the brain that controls the executive function. It's part of the brain that makes us human, make decisions. It gets restored and we can properly start to make those decisions and assess the situation more clearly. With kids, when that's under aroused, when they're not getting good sleep, what happens is they wake up and they have to overactivate to wake up and to, keep up with their peers. So that kind of expresses itself as bouncing off the walls. And then as they age, that will tend to slow down and they'll just kind of be a little bit, sleepy looking or tired. And then for adults transitioning to us, 61% in a national survey, American adults said that they breathe through their mouth at night. This is huge, so more than half. That's quite a bit. I'm pretty sure that James Catlin would not be happy with this number after 160 years of us since he wrote the book "Shut Your Mouth and Save Your Life." But we're doing better, I think. I think things like mouth taping and nasal dilators are trending on TikTok, so that's a good thing. But anyway, this kind of leads us to the part of the lecture where Dr. feeds into Dr. Ross's, where he talked about sleep disorder breathing. So I like to think of this sleep disorder breathing as that's like an umbrella term for all of the problems and that could happen in the airway at nighttime sleeping. And if we go left to right here, we're increasing the resistance to airflow. So less problems over here, more problems over here. And so on the extreme side, we have sleep apnea. Apnea is, A, without air, so the total collapse. And then hypopnea would be the next most resistance, and then UARS, which is commonly overlooked. And UARS stands for Upper Airway Resistance Syndrome. And I'm going to focus on that for a little bit because I do think UARS is sleep apnea is like sneaky cousin that doesn't get any attention. Because what's happening with UARS is that your airway doesn't collapse all the way like you see in apnea or hypopneas. It just gets narrow enough that the brain, once it gets into that deeper stage of rest, your body starts to relax. When the body starts to relax, the muscles and tissues relax. Therefore, the airway starts to close down a little bit. Then the body senses that there's a little bit of drop in the blood oxygen levels. It's going to say, oh crap, let's shoot some epinephrine or adrenaline into the system so that we protect the airway at the cost of sleep architecture. So that's when that epinephrine, that adrenaline is released, and we get the patient, the individual, they'll wake up, not like maybe all the way but they'll be a little micro, what they're watching them, they'll kind of move around the bed a little bit. With kids, it's like them flopping around. And that's a micro arousal. So it's this dance, yo-yo all night long with these individuals of finally getting into that deep rest where they need to be for all these changes to occur and for them to heal. But boom, the airway starts to close down, so the brain's like, oh, I'm not staying down here, we're going back to superficial. So we protect what I'm doing. That's a more immediate need, right? And typically a lot of times with UARS, they present very differently than sleep apnea. A lot of times we'll present as actually really thin and exercise run. A lot of times exercising to the point of that's what they have to do to stay alert, stay awake. Fatigue is a big part of their symptoms. And a good illustration here is the tip of the iceberg example. We're talking about UARS versus sleep apnea. Sleep apnea, this is kind of what we all think of when we think of sleep problems, breathing problems. This is where you get the big mask, the big CPAP. By that point in time, there's usually some like blood pressure issues that have arisen, maybe some arrhythmias, some other things that have come into the picture. But what's underneath is the UARS. And And there's more people here than there is. And what this is important is because we could be somebody who's here could go get a sleep study and they could it passed with flying village. They don't show the numbers, but they could also be waking up 47 times in an hour, but they're not meeting the criteria for those the oxygen desaturation index. And so again, it's not taking into account the sleep architecture. And so instead of seeing that, we wait and wait and wait until they're 20, 30 years down the line, then they have to, then they can get help, which we should start much earlier. I'm going to just briefly cover this. The modern job crisis, we're also working against the agricultural revolution first. Then really the big one was the industrial revolution where everything is processed and easy to chew and eat. After the industrial revolution, totally changed the way we function and how much we use our law. When we look at, for example, this is a native Aborigines in Australia. He's chewing on like kangaroo meat. It's raw. You see like his muscles and his neck, like really getting into it. A lot of our energy expenditure used to be just chewing. So used to we had these huge broad muscles, really strong jaw features. Sleep apnea good or not a thing back then. Perfectly straight teeth, wisdom teeth, and function. So that's just something to be aware of. Another side of this that's working against us. Okay, so we're talking about the nasal airway. That's more or less the theme here. What can we do to improve the nasal airway? You got non-surgical options. Go to CVS and Walgreens and get a little Medipod. That's actually a really good way to clear things up if you're a little bit stuffy. Nasal steroid sprays could be good in small doses. Allergy management, over-the-counter medications, mouth-functional therapy, which I'm not going to be able to get to, unfortunately. That's a huge part of what we're doing now. That mouth-functional is key in both kids and growing kids and adults. And then, of course, orthodontic expansion, which we'll get to. And then surgically, things like septoplasty, turbinate reduction, so they take away some of the bony tissue in the nose. And then adonectomy, tonsillectomy, that's more reserved for the kids, but can be in adults too. And then rhinoplasty, etc. So one area that I'm most passionate about is getting people to use their nose and help them along that way by using an orthodontic expander. Okay, and what's really, we've been expanding in orthodontics for over 100 years. Evan Engel, 120 years ago, was expanding kids. The idea is that you push as hard as you can, really on the teeth, and then that force is transmitted up to these bones higher up, and that forces those bones to open up and separate, and new bone fills in. Now that's a kind of dirty way to expand because you're putting pressure on the teeth and that opens up the high structure. It works, but you're really getting more dental tipping. You're not really changing them in facial structure. At least, kids, yes, you are still, but even up to like 10, 11, 12-year-olds, you really are not doing here. Insert this was like 10 years ago, not around. This is the Marby or bone expander. This has really changed the game in terms of who and when we expand, and not just who, but the quality. This is the application of force with this one. It is actually in the bone itself. You can see that little line there in the middle, that's brand new bone that's filling in and maturing. But since we're higher up, that's actually going to get a much more stable type of, we call it translation, but stable type of expansion. And not only that, but we can do it now on really any age. There's not really a limit to the age we can do it on. I think the oldest patient is 83. I've done an expander on. It used to be that adult males, up to 30, then it's 40 and 50. But, techniques and everything being in mind, we provide this to the non-growing individuals, especially with how much better with the improvements that we see. So the way it works is Here's an example of an expander. There's these little holes here. I'll actually place these tiny screws, the little mini screws right there. Of course, I can do the flipping out of them. And that will lock everything in so that when you're turning, it's those sides. It's not surgical. We're increasing nasal volume to third, it's massive change in the airway volume. Most people see improvements in the AHI, which is just how much of the collapsing per hour. And here's a video of before and after. You can see the changes. The bluish green is after. That's before. This is the nose. The cheekbones. The jaw. So clearly this version is breathing better, correct? And what's cool is it's to the power of 4, it's over the power of 4, so there's a little bit of improvement in volume, and it's exponential decreasing resistance. Okay, here's another example, just changing facial structures, which is so fun. And then we're not breaking any bones, we're not doing any major cuts. Once in a hospital room for a couple of days because of surgery, we're working with the natural lines. Okay, visual lines is just the way the bones connect in the midface, very unique bones in the midface. It turns out there's potential there for bone growth. Will die as long as you put the right forces on. So it's really cool to see this kind of change in somebody that's completely uncertain. And what changes for the patient, of course, breathing better, the nasal volume increases, tongue moves up and forward, because I have more space. That's going to get that tongue out of the back to right there. Sleep. Nasal breathing is going to start to systematically rebuild the architecture. Okay, you're gonna see that normalize over time. New ARS improves results and so the bipolar, etc. And then living just overall less fatigue, sharper thinking, lower blood pressure, less anxiety, quality of life transformation. I would say one of the biggest things with doing expansion and people seeing the immediate benefit thing is if they do exercise now, immediately goes big change. Anaerobic and aerobic. Here's some just common reports for patients, and I'm going to go through this quickly. Here's just an example of somebody who had kind of constricted upper jaw here, and then expanded. Can't listen on there, but expanded. So more space for the tongue. Here you can see the tongue. You see the scalp there? That's a sign of not having space for the tongue. That's a sign that you're supposed to stay problem. After expansion, we have plenty of space for the tongue, and the tongue just kind of disappears. Okay. And then this is a fun part because form follows function. We correct the form, getting them to read better, then the form will follow suit. That's really have to think too hard about it. Things like broad response and the that sort of thing. Also, a lot of the moms called dental basic is doing a little bit more support in the cheekbone area. So yeah, and again, another example, if you go here again, you can see just the change in the width and the changes here. And this is a nurse. She started having a lot of pain during COVID, breathing problems. And this changed her behavior. She was able to get back to work, feel like better, pain improved because of that. So this is a great example where oral facial pain and come together. It's almost going. Okay, well, let's close it up here. So the takeaways, well, we didn't know nasal breathing is the main thing here. Nasal breathing is foundation of everything else that's built on. Adults have options now. didn't have 10 to 15 years ago. And if someone came up to the operator, you take them, hey, your eyes are a little dark, you know, it's a little bunch of shutters. You're not breathing, you don't need to be doing that. Yeah, you do that first. Yeah, thanks again, guys. That's really all I've got. It's an exciting time for me. It's great to be able to provide something that's changing people's lives and also, you know, as a side product, making it a little better. So thank you very much.
We can take just a few questions. Go ahead.
Going to ask with the expander of how long is it in? Is it permanent for the rest of your life?
No. No, it's about, so it really depends. It depends, but most commonly between for adults like 9 to 12 months. Nope, you turn it at home. Yeah, you turn it. Yeah, you actually do it at home. This is actually an older, a little bit older design, but yeah, you see that little key ring there? It's like a little, it's literally a little rich. You turn it. Yeah, that's right. Turning? Yeah, turnings usually last about 3 or 4 months. The next, and then after that, it's just holding to let that new bone fill in so it doesn't collapse when it comes out. Yeah.
You didn't mention breathe right nature script.
Yeah, I'm a big fan. I really am. I'm a big fan of those. Yeah. And I think I've people to use those, and I've used them. They work great. And you know, somebody more recently, I don't know if anyone's seen the magnets that go on the nose. I've heard good things about them. I don't know if anyone else has any thoughts. But anyway, any kind of nasal dilator, breathe right strip is one of them. Can do wonders.
Last question. Tim, did you have a question or?
Yeah, the drilling into the bone. How painful is that? What's that process look like?
Yeah, sure. So really, once you're numb, you're just like, okay, that's a lot of pressure on the roof of my mouth. Then as you go through the. So imagine one the little screws going through here, and then it's gonna like kiss this part of the bone next to the nasal passage there, and you'll feel like a little tickle in your nose. And you feel that. Some people sneeze. But yeah, really for adults, it's just the first day is rough. I prescribe oral steroid now, so that it kind of helps you get over the process. But it's less about the pain and more about like, okay, I gotta get used to eating with this, talking with this, all that kind of stuff. I've had one. The first 2 days are the roughest, and then it gets much better.
You expand the uppers. What happens to the lower?
A good question. Yeah, if we just expand the upper and don't do anything to the lower, then you're not gonna be able to bite on anything. So we also expand the lower, but the lower expands in a different mechanism. So this actually is well, I don't know if it's not gonna show here, but usually if you've got a constricted upper jaw in the mid face, you can expand the skeletal base of the upper. The lower teeth are already tipped in a lot because we call it compensation for that narrow upper jaw. So we just take those lower teeth and tip them out like this, and that's the depth of expansion. So we're not expanding the lower jaw, it's just little movement. Yeah.
Thank you, doctor.
With a yeah, with the line. Yeah, Invisalign.
Man, I need to talk to you. But before you step away, I have something to present to you. Rampaging brings back on Rotary. I hope you'll explain this properly at your desk at the office. Thank you very much.
Thank you.
Right. That's another great meeting. Chatting has an upgrade. Scholarship community members, please stay. Okay. All right. And with that, we're adjourned.
Wow.
This is not
I know.
Yeah, yes.
We went to that restaurant. Johnny loved the pie. Which is so good. So I guess I asked. Stay. Smells of real chicks. Yeah. Yeah. It's was the street of some. Yeah. Size. It's a real old building. It's beautiful inside. There you go. I'm just. Yeah. Oh, yeah. I mean, yeah.
Very good. Supporting. Welcome on.